Hello everyone, my name is Quinn Bissonette and I'd like to welcome you all to our Facebook Live nursing event. This is our second Facebook Live event and you can see the previous video, Opportunities in Nursing, on this Facebook page or YouTube under video links. The former video was about applying to a nursing career at Mayo Clinic, and specifically Rochester gave helpful information and nursing students tips and job seekers about how to actually get your foot in the door. And this is going to be different. This is going to center about relationships. So I'm going to spend a little time just talking about myself real quick. I've been a nurse at Mayo Clinic for 20 years, and I started as a patient care assistant, and then I started working at the bedside, and I worked in colorectal surgery, and then transitioned into general surgery, and I had some supervisory responsibilities, had a phenomenal career at Mayo Clinic. I'm currently a nurse manager at Mayo Clinic. So along that continuum, I've had a lot of opportunities to work with a lot of different folks, and it's really helped me understand the importance of relationships. And once again, that's what this presentation today, that's what this Facebook Live event is all about, is how relationships will differentiate the experience and how we do that differently at Mayo Clinic. I'm thrilled to have two guests joining us today. First, I'd like to introduce Michaela, who is a staff nurse on the cardiac surgery transplant ICU. Welcome, Michaela.
Thanks, Quinn. Good to be here.
And then the second guest is Kirsten, and she's a staff nurse on inpatient general care surgical unit. She's also a staff nurse recruiter.
Yes, I am.
Right?
Yes.
Okay, fantastic. So we're up for a great discussion today. I'm very excited for this. We're going to dive in. We're going to get insights from these two. And again, this is really going to be about the relationships piece. We're going to talk about relationships with the patient, how important that is. We're going to talk about relationships with providers and how that's different at Mayo Clinic. And then lastly, we're going to round this out talking about your relationships with one another, your colleagues. So it's going to be an exciting ride. We're excited that you tuned in, and we're going to dive right into it. So the first conversation that I want to have here is with Michaela. And Michaela has a very special story, and I'm going to let her elaborate on that. But we're going to have her start talking about her experience and the patient and nurse relationship. Michaela.
Yeah, thanks, Quinn. So I have kind of a unique background before my nursing career. I was a patient here at Mayo about 7 or 8 years ago. I got a really severe lung condition called ARDS, kind of straight out of the blue, just an average 16-year-old girl, and ended up inpatient on the cardiovascular surgical ICU. So while I was there, I had 1-to-1 nursing staff, or sometimes even 2-to-1 nursing staff, on a life support that was helping my heart and lungs rest while they were totally kind of just overtaken with this infection. So through this time, I ended up staying in that unit itself for 5.5 months total, which was quite the experience. A lot of it, I would say about half of it, I don't quite remember, just with all of the interventions and medicines, but my parents went through a lot, and we, as a whole family, built some really strong relationships with nurses. You can about imagine, with some of my primary nurses, I spent 30, 40 hours a week with them, and they kind of became like my biggest support system, some of my best friends, and they really were good about addressing these like amazing medical issues, but also kind of addressing that I'm still a 16-year-old girl. Like they painted my nails when they had time, they decorated my room, we went on road trips, they organized scavenger hunts, and in hindsight now, I look back as a staff nurse on this same unit about how much they cared for my parents when my needs were also met. You know, there's the emotional tie that every patient needs, and some of our patients, the only way to kind of address that is through family if they're not is able to kind of communicate back. So I try to take that into my job every day. To think about what kind of emotional support that patient might need, whether they're, young, 16, their whole life has changed from being healthy to now, in an ICU, on organ transplant lists, to maybe some of our older patients that just want to be home or communicate with their children or grandchildren. And I just try to really keep in mind how I can help them beyond the medical piece of it.
So I think that's outstanding. Mm-hmm. Awesome. Mm-hmm. Michaela, outstanding story. And just so my notes are clear, 16 years old, 5 months in the ICU, parents on life support, right?
Right.
In and out, and then have now come all the way full circle back to work on the same unit that you're a patient on for a long time.
Yes. I was really blessed. As a child, I always wanted to go into medicine. I always thought I would love healthcare, but I didn't know quite what until I was a patient here. I knew nursing after the fact was the way to go for me because you can address all of these severe, like scientific, intense situations, but you can also like really bond with people, and it's kind of the best of both worlds. And I think Mayo does an awesome job of kind of steering you and helping you along your journey through your career, just with support in continued education or development with staff. So I feel really lucky. I ended up applying for the Summer 3 nurse externship.
Yep.
After 3 years of college, after I kind of decided I wanted to be a nurse, and was placed on the cardiovascular surgical ICU.
Did you ask for that, or they came, or just happened organically?
Well, it kind of just happened. I got to, once I was made like the top 100 cut, I got to list and rank what units I would be interested in, and that was, of course, my top choice. Such a huge learning opportunity, and I really felt like I could give back with my experience.
Yeah.
So I happened to be placed there, and the transition to a staff nurse was just really easy from there. And I'm about 6 months in now.
Yeah.
So it's still very new, very fresh, and tons to learn. But again, it's some of my coworkers were my nurses, and it's an amazing feeling to see them every day.
Cool.
Some in particular, I'll never forget the day I drove home from Mayo after being finally released from my inpatient stay. I cried saying, oh my gosh, I'm going to miss them. Like, I'm going to miss my primary nurses so much. And I'll never forget my mom just being like, whoa, what's wrong? And I'm just like, I will miss them. You think of the time you spend, the hours. I would kind of joke, they were like sleepovers to me sometimes because I would just be up and bored and we would play a game or talk about music or, you know, do those things that normal kids would do.
Again, I think that is so outstanding. That's just like crazy to come back and work on the unit that you're a patient on.
Yeah.
A couple things that I want to call out here that Michaela said. And again, we're talking about relationships here today. So in terms of differentiating the experience, what Mayo Clinic can provide, a lot of the transactional stuff that had to happen in that stay that was, you know, really important to the clinical outcome, emotionally it wasn't as nearly important as the people. Is that fair to say? Is that accurate?
Absolutely.
Like when you talk about going home, it's the people that you're remembering about. And I think that's super important because the people will always be the differentiating experience. We can do all these fantastic things, but without the people, none of that happens. And I think that's something really special that Mayo has, and it sounds like that's the case with your experience.
Absolutely.
Awesome.
Yeah.
We're going to transition outside of that beautiful story, and we're going to pick on Kirsten a little bit now. So, Kirsten, you don't have to have that wild, crazy, compelling example, but if you could share from your experience, again, the relationships, the importance of that with the patients, and how do you, kind of work around some of that stuff to make sure that is the forefront for you?
Well, here at Mayo, patients do come first. Michaela, your story shows that. That's awesome, amazing. Working with my general care patients, sometimes I have 3 or 4 patients, but I'm able to spend the time with them that they need. I'm able to take time and sit down and do a puzzle with them, or color with my overflow patients, my pediatric population. I am able to talk about what the patients are passionate about. Like the other day I spent an hour talking about half marathons with one of my patients because he'd run so many of them. And I was like, I'm running half marathons. Let's talk more about that. So we found our common love for half marathons. I was able to be his nurse, do all of his nursing necessities, but also spend that time with them. I've had patients who come from all over to be patients at Mayo, and they continually come back because of the nursing care. I mean, the doctors are great. The care is great. They come back to certain floors because the nurses that they remember and care about so much. We've been able to throw anniversary parties for patients who are stuck in the hospital over major life events. Had a patient once who was applying for nursing school. Was going to be a patient for a while, and we were able to encourage her to get into nursing school. Came back to share that she got accepted and was continuing her nursing lifeline, and it was just awesome to be able to inspire her in that way. I'm glad that we are able to make that impact, and I feel like I make that impact every single day, which is so
Awesome.
exciting.
I took a couple notes on Kirsten here now. So a couple things that themes coming out of there is job satisfaction, joy at work, and that comes from, you would say, a large part because we create kind of the system around you to have the relationship with the patient. Is that accurate?
Exactly.
Okay. So again, I don't want to put words in anybody's mouth, but those are differentiating experiences, right? Mm-hmm. That's kind of why many of us became nurses, right? To care for patients. We can talk about fall rates, and we can talk about CHG bath compliance, and we can talk about scores, and all that stuff is very important. Absolutely, that stuff is important. But it wasn't like I was organically inspired one time when I saw fall rates at Mayo Clinic and now I want to be a nurse, right? Mm-hmm. It's because of this drive to have this connection with people, and it sounds like that's what both you're reiterating. So I think that's outstanding. Phenomenal examples of how the patient and staff relationship is exceptional here at Mayo Clinic. With that, I want to transition the segment here. The next topic we want to talk about is the relationships with the providers. And we were specifically nursing's relationship with the providers. And we were fortunate enough to have one of our provider colleagues, Dr. Ziegelman, create a video for us. And we're going to cut to that video now and hear what he has to say.
All right. Hi, Facebook Live attendees. My name is Dr. Matthew Ziegelman. I am a urologist here at Mayo Clinic. And I just wanted to take a moment to tell you how important that relationship is between the nursing staff and the physicians here at Mayo Clinic, whether it's in the operating room, in the clinic, in the hospital-based setting. We approach all of our complex patients using a team-based approach. Everyone's opinion matters. Those relationships we have carry over into providing better care for our patients. So again, just wanted to say what an honor it is to work with the nurses here, and what an important part of the team we all play together. Thank you.
So I think that's great, right? Here's a provider that's got up there and put himself out in front of the world and talking about the relationships that we have with nurses and how nurses are a valuable part of the equation. In my experience, that is exactly how it unfolds in clinical practice. When I started the conversation here with everybody today, I talked a little bit about my experience in colorectal surgery. I started in the ambulatory world over there, and the relationships I was able to navigate and build with the providers over there absolutely built me into the leader I am today. I'm forever indebted to that, and our collective practice has gotten so much better because of it. There is a flat hierarchy. You are literally on the same page with the providers, working hand in hand, and they value what you have to say. That's my experience. I'm a little biased, a little jaded, right? Mm-hmm. So that's why we have guests here, and I'm going to turn it over to you folks again, and I'm going to ask Michaela to start with, if you can elaborate. How about from your perspective, what's it like working with the providers and the nurse-provider relationship?
Right, so again, I work in an ICU. Many of our patients are post-operative cardiac surgery, and it is a very unique sort of relationship that we're allowed to build because on our unit we have a critical care consultant on our unit working with us 24 hours a day, 7 days a week. So that's pretty unique to a lot of units, but really helpful with some of our most unstable patients. With this, we have to work really hard at being really transparent and respecting their presence by always communicating our concerns and being really open and working hard to being on the same page throughout the day with our patients. We also have lots of consulted teams come through in and out all day long with different complex systems cares, and I feel really lucky in our unit that most of our patients are staffed one-to-one. So I'm in the room with them all day long. I understand their case pretty thoroughly in and out just with one patient. So I feel lucky that I can speak to a lot of the questions that the different team members might have. Just with how much time that I am granted to be with them and to sort of dive deep and provide them really great care. And I think another big part that is really satisfying in my job is that they trust our nursing staff so much with how highly we're trained in every area at Mayo, that we can speak to our patients' care and they seek out our input so much more than I really anticipated coming in, especially as a new nurse, a new grad here at Mayo.
So a couple notes I took. Michaela works in an ICU, right? So intensive care unit. It's probably pretty intense environment, right?
Yes.
Okay.
Yes.
And there's a 24/7 presence by the provider, so they're there nonstop. It's not like there's ever, hey, we do things differently here when the doctors aren't around. They're always there, right?
Right.
And then you talked about transparency. So I think that's interesting. So this is a very intense environment where a lot of emotions are running high, but yet we can be radically transparent to have these conversations with each other. And specifically, you said you're free to speak, to share your voice as a valued member of the team, and obviously that impacts perceptions of trust. So you can legitimately care for those patients, somebody exactly like you, in that intense setting.
Right.
Awesome. I'm going to switch over here to Kirsten, get some of her thoughts working from general care. Can you tell me about some of the relationships working with providers in your experience?
So we do have a lot of the same experiences as Michaela does in the ICU. We do have a lot of patients who are surgically managed and with a lot of different services involved. So it's not just the plastics team, it's plastics, ortho, infectious disease, sometimes palliative care, and all of those teams come to nursing and they really depend on us to be that patient's ally, the liaison between all of the services to really know what's going on with our patients. Mine are not necessarily as acute, but all of those services do come seek the nurse out, which is awesome. They come to us asking how the day has gone. They come to us asking for input from the other services to kind of wrap up the care of the patient and make sure that we're getting all the pieces of the puzzle, which is really great. We don't have the necessary the physician at the bedside all the time, but I'm always able to call physicians at any time, a 24/7 support. I never feel afraid to give them a call if I'm concerned about something, and it's really nice to have that open communication and trust.
Fantastic. So my notes on Kirsten. So a couple things you talked about was coordinating care and how the team literally depends on nursing as really that continuity agent for the practice. They're at the heart of it, the patient advocate, and that, again, their voice is valued. A couple other things that each of you brought up, and a couple of these words, trust came up again, collaboration came up again, compassion we've talked about authenticity, especially under the umbrella of transparency. And so those remind me of this moral ecology, right? That as we unfold here at Mayo Clinic and as we look to the future, really consistent with a lot of our primary values. And it's one thing for an organization to talk about values, but it's another thing for them to actually live them. And it sounds like, in your experience, you're actually able to live those values. Is that accurate?
Completely.
Yeah, absolutely.
Yeah, that's outstanding. From a patient perspective, from a provider perspective. Now, the third segment here we want to talk about is really centric to teamwork, and it's actually going to be about relationships working with each other. Right, because in nursing, sometimes there's that old paradigm, nursing eats the young, or this X, Y, and Z, or we're a patient here, so you have this, maybe prescriptive experience that we think is going to happen, and it's probably crazy to come back in and work with this staff that actually took care of you at some point, right? So I want to talk a little bit about the relationships that you have with your fellow nurses. What's that like? Let's start with Kirsten this time to spice it up and make it crazy.
Oh, perfect. Gosh, my nurse relationships are, amazing. On my floor, I feel so close and connected to all my fellow nurses. And some of that connection actually started during the nurse residency program. I met a couple nurses that were working on my floor, nurses from other floors, so I was able to collaborate with them and hear how things are going on other floors. I feel comfortable when I float to different units. I always feel welcome no matter where I'm at. Through orientation process, you get a couple primary preceptors, and I could ask them anything, absolutely anything, about where to live, where's the best place to get lunch, like absolutely anything. And they never made you feel small or little when you had quote unquote little questions, because as new nurses, you have all sorts of questions. So I always felt like I could go to them and always felt completely supported in my unit. Had great relationships, which is awesome.
Awesome. So Kirsten talked a little bit about connections. She talked about feeling welcome. I always say it's a powerful thing to feel wanted, right? So in a setting like that, a work setting where you feel wanted, where you're deeply connected, where you're evolving with, the same vision, it really creates kind of a community, right? And so that community kind of reframes the identity and you grow together. And it's fun to be a part of it. Yeah. Thank you. Let's switch gears and go to Michaela. Talk a little bit about your perspective of nurse-to-nurse relationships.
Yeah, so a little bit more kind of geared from the perspective I've had on our unit. It's really a big blessing having, again, that kind of one-to-one care. There are many nurses on staff at a given time. We also have several resource and charge nurses that are so knowledgeable. And again, as a new nurse, new grad, emotions can run high and questions can come up really, really quickly. And to always have kind of a buddy or a neighbor next to you, charge nurse rounding, I've always found that it's so easy to get a hold of a colleague, really for things to better the patient situation. Another big blessing I have found on our unit is that we have a lot of opportunities for little touch points. We'll have our program called Healing Hearts, where we'll kind of get together as a staff about once a month and have an opportunity to sort of de-stress, discuss things that have happened, whether a patient situation didn't turn out so good. Dealing with loss as nurses is hard as well. So to have the chaplain support during that, senior nursing support, it's really been really helpful for a transition through. I mean, it's hard to be a nurse. It's amazing, but it can be hard. So I think that is one of the biggest things that I lean on through this big transition point in life, in such a difficult job, is to have those people that have been through it that are great mentors, because they can really attest from their perspective and what they've been through and kind of help guide you along healthy ways to kind of cope and keep pushing forward and doing the best for your patients.
I love that you say lean on, right? Mm-hmm. You're not saying rely completely on or throw on the flag or I can't do it. Mm-hmm. It's lean on it, right? So we bend a little bit, we never break. We're in it together. Mm-hmm. You talked about the charge rounding. So again, that's that senior nurse presence where we have a legitimate investment in our future, the talent, right? The people. Mm-hmm. And that's really the common denominator in all of these themes is the people. It's people like you, right? That differentiate the experience. And that's, my opinion, one of the phenomenal things that Mayo Clinic offers, whether it be in the patient interaction or whether it be working with our provider colleagues or whether it be working with your nurse colleagues. The people really differentiate it. And that's why it's part of Mayo Clinic's strategic plan that we invest in the talent, the people. That's fundamental in our Maslow hierarchy, that we invest in the people. So those are fantastic examples, and I'm so grateful that you're willing to share those experiences. Unfortunately, that is all the time we have for interview questions at this point, so we want to leave some time to answer viewer questions. So we're going to throw it up here and see what questions we have. And it looks like we do have a question. How do you make time to have a relationship with the patient when you're busy doing so many things? So either one of you that would like to jump in on that one.
I have a few examples. Again, that can be really hard. But again, with where I've worked, there are a lot of people in and out that offer to help. There's different resource nurses, charge nurse, patient care assistants that will come say, like, what can I do for you? And so I've learned really quickly that, make a list, have your tasks set out for the day, and try to knock them out quickly and strategically so you can bond with them. Another thing is getting good at multitasking, sort of chatting through things and bonding with your patients during other tasks that you have to do. Maybe you have a chest tube dressing change to get done, but you can kind of make the most of it and try to chat through it, especially to almost take their mind off what might be going on during the day. So trying to divide your time and care for them during tasks that have become more routine.
So I love that, right? Now we're talking about some of the transactional tasky stuff, right? We go to nursing school, we make these huge Nordic care plans, and then we come in to, prep for the shift before, and then we go through these series of checklists, and then you start orientation, you go through orientation, you do all these checks and checks and checks and checks, and most of that is transactional tasky stuff that absolutely has to happen, right? But what it sounds like you've been able to do is navigate that checklist and add something very important back in there. And that is that I have a relationship with the patient. And you build it in a strategy such that works for you. consistent with kind of the transactional nature. So that is awesome. That would be a great take-home point for everybody, including myself. So great answer. Thank you. We do have more questions coming in here. So let's see. What do teams or teamwork mean at Mayo? And let's lean on Kirsten for that.
Well, we did discuss teamwork a lot through this. I think we all have great relationships with our physician care team, our charge nurses, all of our resources, whether that's social work, occupational therapy, physical therapy, dietitians. They all collaborate with us and our patients to give them the well-rounded care that they deserve. So we do really take everything to team approach. We have multidisciplinary rounds. Each unit does it a little differently, but my unit, we do it at 9:30 every morning. Pharmacy comes, social work comes, the providers come, spiritual care generally comes. We can talk about all those issues that the patient might have, and they really look to nursing at that moment for what the plan is for the day, how are we going to get that patient home, and move their care along through their stay.
So another awesome example, all the supportive structures in place to facilitate that connection with the patient and or staff providers. So really that experience piece, and these are all tools to augment that relationship. So outstanding. Ooh, we're getting a lot of questions here. Okay, let's see. How do you make sure everyone's treated respectfully? And we're going to jump back to Kirsten on that one just to make things spicy again.
Oh gosh, love spicing it
You
up.
love it, right? You gotta do it.
Well, here at Mayo, I feel like we all know our values, our 8 core values, that the respect, the integrity, compassion, healing, teamwork, innovation, excellence, and stewardship. We know all those values, and because we know them and we strive towards them every day, it's just second nature to treat everyone with respect. I mean, it's quite simple as that. I feel respected by my coworkers. I feel respected by my leadership team. I feel respected by the physicians, and we all work towards that common bond.
Yeah, embedded early on.
Yeah,
It's just
right
part of,
away.
like we said, the moral ecology, part of the foundation. Create the support systems and structures around you so that you can live out those values.
Exactly.
And awesome that you can recite them. Strong work. So very cool. I think we got time for one more question here. Let's see. Why do nurses come and stay working at Mayo Clinic? Michaela.
All right, I'll do my best. So, people know Mayo. People seek Mayo. Patients seek Mayo. You think about just the name that it's got, the reputation that we have. So beyond that, I think it's pretty easy to say that, very impressive and striving for excellent type people will, kind of gravitate towards Mayo as well. Between the new technologies, the new research, education, and excellent patient care, it's a pretty easy transition to come work here. And we really, I think, in my opinion, get treated so well. We'll joke about how great it is to work here and how hard it'd be to leave. And I think that Mayo really kind of makes that happen. They invest in so many aspects of the care that we give so that we can make relationships with patients, kind of like we talked about. They empower us so we can do that, and to get so much satisfaction from using all of these groundbreaking scientific methods and having all this time to build patient relationships. It's just so rewarding in so many aspects of my job so far that I can see why people really want to stay here and want to make a career out of it, and to be guided through different continuing education and different supporting members on our teams to kind of push you and help you get to where you want to be. Whether that's, that same staff nurse for decades or maybe your whole career, or whether that's evolving into new roles as you grow as a person as well. There's never like a standstill, and I feel very open with to keep letting my career evolve as time goes on.
Outstanding. So I heard the words investment, so you feel like there's a legitimate investment in the people. That's motivating to stay. There certainly is an interest in pursuing technology, machine learning, artificial intelligence, leveraging predictive analytics, and using all of those as tools to position you again to have that connection relationship with the patient. You used the word empowerment, consistent also with feeling invested in, satisfaction, and again, we came back down to the relationship piece. So outstanding. There's a question about how can I apply to get a job at Mayo Clinic. We'll reference you to the previous video that we did on Facebook, or you can go to the website jobs.mayoclinic.org to apply there. And that, folks, is all the time we have for questions. So please continue to submit them on the link below, and we will get to them within the next day. We appreciate your time and participation in this Facebook Live event and learning about how relationships differentiate the Mayo Clinic nursing experience. Please follow Mayo Clinic on social media through Instagram, Facebook, Twitter, LinkedIn, and YouTube for upcoming nursing events. And I want to make a special thank you to Michaela and Kirsten for joining us and sharing your perspective. If you have any interest in career opportunities at Mayo Clinic, again, that website address is jobs.mayoclinic.org, and send any questions to placement through the email on the screen. Thank you very much for watching.